Hey, I'm back. Okay, so I don't have a lot of time here because my son is making noises. So let's get started with the intermittent catheterization. Uh, I went over my pick. I did pass. I wanted to mention that I did go out of the order as far as labeling, initially, and putting a tie on the little strip to put on the uh, pig dressing. You, to be safe, just do that last. Um, One of the hands would have been contaminated anyway, so we're saying that you can touch the package with both hands, contaminated or not. So at this point, I'm like, it really doesn't matter if I pick up a pen, my hand is already contaminated, and it doesn't matter, your hands does not have to be sterile to touch that transparent dressing. You just cannot touch the sticky part, which is sterile. You can touch any other part of it with sterile or non-sterile hands. So that's the only reason I went on and labeled it before I put it on. I didn't contaminate anything, so, but just to be safe, I would just do that last. And I'm going to do it last just to be safe because I don't want any problems. No, I don't want to fail for nothing stupid. So that's that. And they also said that things will be done different, but long as you do what you're supposed to do and maintain a sterile field, then you're fine. So let's get started here. Review the medical record. These are things that I have to do. Review the medical record to determine procedure to be performed. I have on my retainer, so if I sound a little weird, that's why. Document procedures to be performed based upon information contained in the medical record. Select the supplies and mannequin needed for the procedure. Perform hand hygiene. Verbally identify the patient, comparing two pieces of information on the patient's identification band against the medical record. Backspace delete. I did think I failed the pick one, because I couldn't remember if I had sanitized my hands at the end. So I was like, I didn't sanitize my hands at the end. I failed. So that's a reason. Another reason it's good to do these videos and record yourself and go back and watch, because I did sanitize my hands at the end, so I did not fail. But I'm just happy that I am recording myself so I can see what I'm doing, what I'm not doing, and what I did do that I thought I didn't do. Okay, so place the patient in a position to see the urinary meatus. Respect the patient's privacy. And it doesn't say in this list, but respect the patient privacy means, pull the curtains back, cover the patient, respect the privacy. If you are right-handed, stand on the patient's right side, and if you are left-handed, stand on the patient's left side. Open correct packages. Package using principles of aseptic technique. Don sterile gloves. Once you have donned the sterile gloves, you can touch the items located in the catheter kit. Lubricate the catheter, which means open the lubricant and squeeze it out inside of the receptacle. You can also put that lubricant on the sterile drape that's under the patient. You can do that. It's not in their steps, so I wouldn't do it. But if you have a habit of doing it like that, I don't see why you would fail, because that pad is sterile. So lubricate the catheter. Separate the labia with your non-dominant hand. Cleanse the perineal area with your dominant hand. Wipe from front to back in this order. Far labia majora and near labia majora. Hope I'm saying that right. And then directly down the center. So far, near, center. And that's just so you're not reaching over it after you already cleaned it. So you clean the near and now you're reaching over it to clean the far in the middle. So discard each swab after you use it. You should not reach over a sterile field. Position urine receptacle. Insert position urine receptacle. That means the receptacle that the contents are in. After you put a drape under the patient, then you can move that and put it on the drape to bring it closer to the patient so that you can get the urine out and into that receptacle. So position the urine receptacle, insert lubricated catheter to appropriate depth. There will be no visible urine return in the nursing stimulation lab. Withdraw the catheter, dry the perineal area with the underpad, discard the supplies, remove gloves, perform hand hygiene. That's it. Simple. These stations are very simple. The only thing they trying to make sure is that you know how to keep things sterile. That's it. You don't break the sterile, sterile field. That's what this is about. But this stuff is so simple. But don't go in there moving all fast. Like, let me knock this out in 5 minutes. I do this all the time. This is quick. That's where mistakes come in. So just take your time. Be patient. You have 30 minutes. Be patient. Then a sample documentation. At 1800 (6 p.m., bladder scanner indicated 500 milliliters of urine in patient's bladder. Patient catheterized with number 12 French intermittent urinary catheter per physician's order. No resistance noted. That's simple. No need to say too much. Put this on the charger and get started. Get some passion juice. Okay. So, medical record, go over it. Oh, I have to do a urinary catheter today. Tell the seat, check it. See, you said yes. I may continue. So, going to get my vagina. I'm going to get my kit. And I'm going to get my sterile gloves. That's a large. Kit and sterile gloves. Got it? So, that's all you need. I have the gel and the timer over here. We don't need a pen or tape. Got that. So, now I'm gonna go in the room. Hi, I'm Angela. I'm a student nurse. You mind if I wash my hands? Or I'm going to wash my hands. I'll be right back. But the sanitizer is here on the table, the hand gel. Clean them. Okay? So I am going to identify the patient. Okay. I have to identify you against the medical record. So I'm going to look at your name, band, and ask you the questions, if you don't mind. Can you tell me your name? Okay, yes. Lisa Duncan. Yes. Your date of birth, 3/24/81. Okay, thank you. Correct. So this is who I'm working with. Are you in any pain right now? Okay, good. No? Good. Okay. I'm going to raise the bed to working height, which to my elbows or waist. Okay, so I'm going to do an intermittent urinary catheterization per doctor's order. You had some residual there. So first, I'm going to drape you. I'm just going to gel my hands again. I'm going to drape you, provide privacy. So, as you can see, this is the vagina and this is the anus. So, I'm going to pretend that this is the vagina and this is the meatus. Okay? Provide privacy. Open my gloves. Open my kit. Okay. Everything's open. I'm going to, let me, my check off. This is the check off that my C will be referring to make sure that I do all the steps. She'll check it whether I passed or failed. So what they're going to be looking for the urinary catheter is that I review the medical record to determine the procedure, and I perform hand hygiene, and I verbally identify the patient by comparing two of the following pieces of information on the patient's identification band against the medical record: the patient's name, date of birth, medical record number. Then they're going to make sure that I respect privacy by draping a mannequin before the procedure, cover the mannequin after the procedure, select correct catheter size, apply sterile underpad, cleanse the urinary meatus with the swabs, discard cleaning materials in appropriate container, position urine receptacle, insert lubricated catheter to the You know what? And I put this in a position where I thought it would not fall out, but darn thing still fell. I'm gonna have to buy another one of these, I guess, because it is not doing what it's supposed to do anymore. It's not holding. I didn't even know y'all could even see anything. Okay, apply sterile underpad, cleanse the urinary meatus with the swabs, discard cleansing material in appropriate container, position urine receptacle, insert lubricated catheter 2 to 3 inches for female or 5 to 7 inches for male. And then we're going to withdraw the catheter, dry the perineal area with underpad, and discard the supplies. document data related to urinary status, time of current catheterization, size of catheter. Complete the procedure within 30 minutes. Adhere to professional behavior. Perform procedure with allotted supplies. Did that just fall down some? Hopefully it doesn't fall out again. Okay, I'm going to do all this over because I did not set my timer. Okay, I gave her. What is going on with this thing? It's just moving and moving. Oh, it's like a scary movie. I wonder why it's doing this. It's just so stupid. I'm gonna have to stick something in there to keep it from moving. I am so sorry that we are going through this stupidness. Try to wing it. And hopefully it will stay. Okay, so here we are. Let's try it now. One moment, hold on. Okay, sorry about that. All right, so I gave it back. She said I can continue because yes, it's the urinary catheter that I have to do. So set the timer. 30 minutes. It's the loudest thing ever. Start. Okay, so I will gather my supplies. I need the mannequin, the catheterization kit, and sterile gloves. So I got that stuff. Now I will go to the resident's room, sanitize my hands. Hello, I'm Angela. I'm the Excelsior nursing student. I need to verify your identity with your wristband, and I will also ask you questions if you're fine with that. Okay, can you tell me your name? Okay, Lisa Duncan. Yep. Your date of birth, 3/24/81. Yep, okay, thank you. 2 identifiers. So, are you in any pain right now? No? Good, okay. I'm gonna adjust the bed to working height, elbows, waist. Thank you. I'm gonna sanitize my hands again. I am going to drape the there, and like I said, vagina meatus. Okay, so now I am going to prepare my sterile glove. And I am going to open my catheter kit. Can't you see this anymore? What is going on? Okay. All right. So you see everything in there? Good. So everything, got it. So I'm going to don my gloves. I have to be on the right hand side though. But I am on the right hand side. So this is the patient right hand side. I'm right handed. And that's so I can use my non-dominant hand to hold open the vagina. So don my gloves, sterile gloves. Grab it by the cuff. Put my hands in there. Only touching the cuff. Grab the other one. 2, 3, 4 fingers in the cuff. Under the cuff. Got it in there. Good. Okay. So now I am going to get the drape. Okay. I don't know if I failed or not because I didn't get the drape before I put on my gloves or not, but the drape wasn't at the top anyway, so I would have contaminated some stuff. So if you didn't have on your gloves, you would only want to touch the end. And sunny side down. I mean, the shiny side down. It's sterile, so I can touch it. But let me practice as if I did not have on the gloves. So sunny side down, and a way to remember how the drape, how to lay the drape, is just remember the sun shines down. Sun in the sky, it shines down. So shiny side is down. So let me find the shiny side. Guess it would be this one. Yeah, so you would want to have your sterile gloves on because you have to kind of move the patient to get it under there. So I'm going to act like I don't have on my sterile gloves. That's why I'm touching the ends. So lift the patient, touching on the edges, scoot it under the patient. Okay, so I did that. Now don my sterile gloves. I did that. So now that I've done that, I can move I would take this whole thing off because the outer portion is contaminated. So I'm just going to turn this way so it's not, that's not on my sterile field. So I'm going to open up my iodine. I'm take it from over the sterile field. Be careful because this stuff can splash. So be careful when opening this. Throw that away. Just drop it in there because you want to keep your arms above your waist. Put that to the side. You want to open up your lube. Squeeze it in there. Drop that in the trash. Get the end of your catheter in the gel. Take your non-dominant hand. Spread the vagina. Fire labia. One swipe down. That in the trash. Front to back. Near labia. Front to back. Center. Center. Front to back. Throw that away. Throw that away. Put it 2 to 3 inches. I would place my hands, my fingers where, I hope you can see. Leave that in the receptacle so the urine can drain out there. So place it in there. 1, 2, 3 inches. Oh, urine is coming out. Blah, 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 blah. That's good. Take it out. Put it in the receptacle. Move that out the way. Wipe the patient. One wipe down the middle. Cover the patient for privacy. Get rid of the stuff. Take your gloves off. Sanitize your hands. Put your stuff back. Document. And that took 11 minutes. So that's that. Sorry for the technical difficulties. Sorry about the draping issue. Doing that without with the sterile gloves, and they actually want you to reach in there and get it with your bare hands, because you may have to touch the patient. Because some patients, you know, can't move themselves. They can't lift up. So you want to be the one, you may have to be the one to lift them up and place that. The first drape that was in there, I wouldn't use, so I guess it doesn't matter if I contaminate that or not. But I guess the kits that they have, the first thing on the top would be the drape for the bottom. So if it's set up like that, then that's fine. Just get that out and put it there. So I talked through it. I knew what I did wrong as far as the draping issue with the sterile gloves. So being that I talked my way through it and know what I did wrong and said that I would do it different, then I would consider me passing this station also. I hope you guys were able to see it, because I wasn't able to. I didn't bring it closer. I got to get another tripod to hold this thing up. So I will watch the video and see what I did right or didn't do. And the next one would be medication administration, oral. And we'll go from there. I'll let you know if I passed it, or you can let me know in the comments. So thanks for watching. Thanks for subscribing. If this is your first time watching, please subscribe. More videos to come. Like, dislike, leave a comment. I hope this helps someone. You guys watching these videos, liking, disliking, leaving comments helps me. So that's that. And I will see you guys for medication administration, the oral route. I don't know if I got it in me right now. I may not, but tomorrow I'm going to have my girlfriend come over and she'll help me with my son. So I have to pump so she can feed him when he's hungry, which is all the time. That's why I don't really get a lot done. So hopefully tomorrow I can get the medication administration, oral, IV, mini bag, IV push, IM, and sub-Q. Hopefully I can get all those done tomorrow. I'm in my normal saline. My primary and secondary bags came in that I ordered. And this is real stuff. Some of the websites were saying that I had to have a prescription to get this stuff. So hey, you can really order this stuff. If you have a hangover and have to go to work the next day, I can hook you up. Joking. Okay, so thanks again, and until next time.